North Korea is by far the most isolated country in the world. So when the World Health Organization declared COVID-19 a global pandemic in March 2020, it was easy for North Korea to close its borders to the world, even with its closest neighbor, China. For nearly 2 years, it stayed that way. And according to official numbers, North Korea avoided a single case of COVID-19. But on May 12, 2022, North Korean leader Kim Jong-un announced the country's first outbreak. According to the Korean Central News Agency, the state's most serious emergency has occurred. A break was made on our emergency epidemic prevention front that had been firmly defended until now. The country has since reported over 3 million cases of what it calls fever, the term used for suspected COVID-19 cases. North Korea lacks the testing capacity to confirm them. A maximum state of emergency has been declared. The entire population is under a full lockdown, and clinics have reported shortages of medicine. Experts worry North Korea's poor healthcare system could lead to thousands of deaths in a country that already lacks sufficient food and medicine supplies.
WHO is deeply concerned at the risk of further spread of COVID-19 in the country, particularly because the population is unvaccinated.
So, what caused North Korea's COVID-19 disaster? And how long has it really been going on? North Korea's approach to the pandemic has been notoriously hardcore. Even before China locked down Wuhan, where the first COVID-19 outbreak was reported back in 2020, North Korea had closed its borders and stopped Chinese goods from coming in. There was even an early report that a South Korean who swam into North Korean waters was shot and burned at sea out of fear he was infected with the coronavirus. For 2 years, the country officially reported 0 COVID-19 cases, making it one of the world's few countries to be COVID-free. But that's almost impossible to verify, considering Pyongyang's record of misinformation. Regardless, the virus has been contained enough to hide, at least until May. 3.4 million people have been reported sick with fevers since May 12, 2022. That's about 13% of its population of 26 million people. With that many ill, is North Korea prepared to handle it? Experts suspect that the outbreak was caused by large events held in April by Kim himself, with fireworks and a procession in the capital's main square to celebrate the 110th birthday of his late grandfather and DPRK founder, Kim Il-sung. About a month later, crisis ensued, and state-run pharmacies have run out of essential drugs. After visiting a few patients in Pyongyang, Kim admitted the country was not well prepared and criticized the medical industry for having an irresponsible work attitude. His blunt criticism may be a sign North Korea was unable to ignore its COVID problem or even deal with it on its own.
접종을 맞고 있어 왔던 그 사람들이 아닐 가능성이 높기 때문에 이런 이제 오미크론이 들어왔을 때 이제 그 전파 그다음에 그 전파로 인한 일종의 어떤 여러 증상들 그리고 그것을 의료 체계가 얼마나 감당해낼 수 있는지 그리고 치료제라든가 여러 가지 후속 조치들이 얼마나 시스템적으로 잘 지원될 수 있는지 이거는 다소 조금 우려스러운 상황이라고 보여집니다.
Other countries have offered help, but Pyongyang continued to reject it. North Korea and Eritrea don't have a vaccination program. In response to the latest crisis, the U.S., South Korea, and the World Health Organization have offered to deliver vaccine and medical supplies to North Korea.
We've offered vaccines not only to North Korea but to China as well.
북한 당국이 호응한다면 코로나 백신을 포함한 의약품, 의료기구, 보건 인력 등 필요한 지원을 아끼지 않겠습니다.
But Pyongyang historically rejects help from Western nations. And this time, it's no different. North Korea has yet to respond to their offers. China, however, may have found a way to help.
我们对朝方当前面临的防疫形势感同身受。作为同志、邻居和朋友，中方随时准备为朝方抗击疫情全力提供支持帮助。
There's evidence that North Korea scrambled for medical supplies back in January. From January to April, there was a 100-fold increase in respiration equipment imported from China, including ventilators, patient monitors, and face masks. But when it comes to vaccines, North Korea has remained adamantly resistant. In 2021, Pyongyang rejected nearly 3 million Sinovac doses from China and refused over 8 million COVAX doses from the WHO. Without vaccines, North Koreans lack the most effective way to protect themselves from the coronavirus. What does that mean for its civilians? North Korea already struggles with poverty rates and low food supply. 42% of the population is considered malnourished. And that's only worsened in the pandemic, with Chinese goods cut off, a drought in 2020, and massive flooding that followed. It has become difficult for North Koreans to even put food on the table. So how is Pyongyang responding? Kim has deployed the military to deliver supplies and launched a public information campaign led by North Korea's own Dr. Fauci figure, a state health official named Ru Young-chol. He has encouraged traditional medicine like herbal teas, gargling salt water, and using over-the-counter painkillers like ibuprofen to treat suspected fevers. On May 29th, Kim assessed the outbreak's progress and said the situation was improving. 100,710 new fever cases were reported on May 30th, 2022. That's down from nearly 400,000 a week earlier. Now, if we take those numbers at face value, North Korea has the latest outbreak under control. But compared to other countries with strict measures, like China, which has taken months to control its Omicron outbreak, experts say it's unlikely that North Korea is telling the truth.
불구하고 이 확진자 숫자라든지 또는 사망 숫자 많이 나오면 주민들의 공포가 감히 팽배해지고 그럼 이것이 민심 위반으로까지 될 수 있기 때문에
It's tough to determine as we only have state numbers to go by and experts who rely on testimonies from defectors. For now, countries can only continue to offer help with vaccines and medical supplies in the hopes that lives can be saved.